Vision correction. Vision correction is to diagnose and correct your vision. Keep in mind that only an eye care professional can diagnose your vision problem and provide guidance for vision correction. Glasses and contact lenses are no longer your only choice for clear vision. Today's advancements in vision surgery give us freedom from corrective lenses. We can feel more confident and younger with our vision restored. What causes vision problems? Changes in the shape and size of your eyes can cause problems that affect the way you see things that are close up or far away. These problems are referred to as refractive disorders. Refractive disorders include myopia or nearsightedness, hyperopia or farsightedness, and astigmatism. Presbyopia is an age-related eye condition that affects everyone sometime after age 40, making it difficult to focus on objects up close. Laser vision procedures. Photorefractive keratectomy, PRK. Laser in situ keratomileusis, LASIK. You can correct both eyes at once. Yes, most patients find it more convenient to have both eyes treated at the same time. Having your eyes corrected on separate occasions only extends the healing time and increases the number of required post-operative appointments. How do I know laser vision correction is safe? In the US, follow-up clinical trials have been conducted for the last 3 years with very few sight-threatening complications occurring. Outside the US, millions of procedures have been performed over the past 6 years. How many people have had their laser vision correction? Surgeons have performed over 5.5 million laser vision correction procedures in the United States since the year 2000. Is laser vision correction safe? And are these procedures FDA, Food and Drug Administration approved? Yes, both PRK and LASIK procedures are FDA approved. The amount of approved correction depends on the laser used. The FDA recognizes LASIK and PRK as proven, safe, and effective. There are risks associated with any surgical procedure, but laser vision correction has many safeguards. Conductive keratoplasty. What is conductive keratoplasty? Conductive keratoplasty, or CK, is an alternative to typical laser surgeries for people who are over 40 and have hyperopia, astigmatism, or presbyopia. Developed by Refratech, the process received FDA approval for reduction of hyperopia and in March 2004 received first an FDA approval for vision technology that improves presbyopia. Corneal transplantation, also known as corneal grafting or penetrating keratoplasty, is a surgical procedure where a damaged or diseased cornea is replaced by donated corneal tissue, which has been removed from a recently diseased individual having no known diseases which might affect the viability of the donated tissue. The cornea is the clear part of the eye in front of the iris and pupil. The surgical procedure is performed by ophthalmologists, medical doctors who specialize in eyes, and are often done on an outpatient basis. That is, the patient goes home following surgery. Eye muscle repair. Definition. Eye muscle repair is surgery to align eyes or correct eye muscle abnormality, that is, strabismus. Description. The surgery is most commonly done on children, but is also performed on adults with similar problems. While the child is under general anesthesia, Asleep and pain-free, a small incision is made in the tissue between the eye and the eyelid, conjunctiva. One or more muscles of the eye are strengthened, resected, or weakened, recessed, to allow proper position and help the eye to move correctly. After a few hours of recovery, the child may go home. The surgery for adults is similar. Adults are usually awake or sleepy but pain-free. Often, in adult surgery, an adjustable suture will be used so that minor adjustments can be made later that day or the next day. This technique usually gives a very good result. Treatment for dry eye. Although there is no cure for dry eyes, relief for dry eyes is readily available. Below are listed surgical, non-surgical, dietary, herbal, and lifestyle options to help dry eyes treatment. You should discuss treatment options with your physician or optometrist, ophthalmologist to determine what treatments will yield the best results for you. Surgical options. All surgical procedures are done on an outpatient basis with local anesthetic. The ducts that drain tears into the nose can be permanently sealed so that more tears remain around the eye. Consult a physician or optometrist, ophthalmologist to determine if you are a good candidate for surgery. Non-surgical options. Non-prescription eye drops and ointments. The primary treatment for dry eye with a wide variety of options available over the counter. Avoid eye drops that contain preservatives or methyl cellulose. If your eyes dry out while you sleep, you can use a thicker lubricant such as an ointment at night.